Thank you. So firstly, I just want to say thank you for having me here to talk around our piece of work that we've been working on for the past 6 months to a year or so, which is all around digital maturity and how you use technology in maternity services. So just to introduce myself, my name is Ben Howell. I'm one of the project managers from NHS Digital. NHS Digital hosts a piece of work called the Digital Maternity Programme, and that piece of work links very closely to the work that Charles was talking about earlier on in terms of the Maternity Transformation Programme, and we are one of those work streams that's all focused on harnessing digital technology. And so our team at NHS Digital, we're trying to meet the needs of better births that were identified, the requirements that were all around using technology. So we have a number of projects within our programme of work which I'll speak about at the end of the presentation. The project that I'm here to talk about today is the Maternity DMA, or Digital Maturity Assessment, and this is a piece of work that we conducted start of the year really up until very recently when we went live with the work around October time. So I'll just be talking through in a little bit of detail there around what the project was about, what it was trying to achieve and what we did. Then I'll move on to talk about the LMS report for your LMS in particular and what the findings were that are particularly relevant to yourselves. Then I'll talk about how that links to the national findings, and then I'll talk about the sort of next steps and potential resources that we've got available that may be of use to you. So what is digital maturity? Lots of people have different definitions, and it's possibly not a widely understood term. But for me, it revolves around one question, which is how well are we using digital technology within maternity services? The image I've picked here is of someone exercising, because in a sense, it's a bit of a health check for how well technology is being used. And it's just starting to create a baseline and measures against which you'll be able to say, how well are you using technology in all different aspects, and how does that fit into a bigger national picture? So the benefits of digital technology, I think Charles touched on it a little bit earlier on. The interesting thing for me is the fact that there is this expectation now from women out there that most things in their lives are digital. Banking's digital, booking a holiday is digital, very few letters in the post, and yet often when they interact with their maternity service, they find that they end up holding paper notes and carrying a lot of paper around, and there's not that digital resource necessarily available. And when you adopt digital technology, there's a number of benefits that can be associated as well in terms of releasing time for clinicians so they don't spend as much time doing paperwork and they can use that time to focus on providing care. And there's advantages in terms of safety and cost as well from application of certain technology. So there's a wide range of benefits that can be obtained when technology is used well. So the assessment itself and the definition of digital maturity for me isn't just about the technology and about how whether you're doing something or not as a measure. It's all about how prepared you are as a team, as a maternity service, to adopt new pieces of technology and to make changes to do that digital transformation. Effectively, the technology is just an enabler to doing the things that you're already doing better. So it's all around the people, the processes, and the technology is just the thing that enables that, really. And that's just something I wanted to sort of really get across before I went into the detail of it all. So what did we actually do? So the assessment opened at April, and it closed at the end of June. And during that time, we were able to collect information from every maternity provider in England, which is about 135 providers. And what we were really trying to do was collect information straight from the maternity service. We wanted somebody who's a practicing clinician in the maternity service to be providing us that information. We didn't want to go through layers of corporate channels to get to the detail because a lot of that information would be boiled down. We wanted to ask really focused and specific questions. And so when we did a check on who actually was the people who completed this assessment, we found that more than 75% of them across the country were midwives, and the rest were made up of clinicians and business people. But we just thought that's a great measure of the fact that we've got a real picture from people who really are within these services about how well they're using technology. And we got that complete picture of England as well. So we held a launch event in October. So between basically July to October time, we were analysing the information. And we were producing a number of outputs, which I'll talk about in a minute. But we couldn't have done it without our stakeholder group. So when we first formed this group, there was perhaps about 20 people from across the country who are in that sort of digital space for maternity. But we were able to grow that group, and we were able to find more interested people who were wanting to collaborate and find out more about the digital technology. And so this was the group that we held back in October, where we launched the products. And the theme of the day really was about extending humanity, as was the phrase then. So basically this idea that though we explored some quite detailed and technical topics around digital maturity and technology, we were always bringing it back to the patient and to the clinicians, and about how it's actually helping the care rather than it just being a means to an end. And that was a theme that just organically came out of the day, really. So in terms of the actual outputs, every LMS, all 44, were given an LMS report, and that's full of statistics, graphs and diagrams, and it's comparing each provider within that LMS, and then it's comparing that LMS against the national averages. So that national average is the sort of baseline really that helps you understand where you sit relative to other providers in the country. And then there's a national report as well, which is this big hefty electronic document full of resources and links and analysis at a national level, which I'll touch on in a little bit in a bit more detail. So just moving on to specifically what we found for your LMS. So just before I mention that, I should set the context about what we saw when we looked at the LMSs as a whole. So it was a real mixed landscape out there. In terms of provider level, there are some that are way ahead of the curve, and there were some that are perhaps still struggling to adopt technology. And we'd always suspected that anecdotally we'd had a lot of stories and we'd spoken to a lot of people, but this was the first time that we had this evidence to prove the full picture of England. And it's worth saying that there is that variation. Even within one maternity provider itself, there are certain things that are doing really well, and perhaps other areas that they're still struggling on. So here are two maps of England. So the first one is all the LMSs listed and the 14 topics that we explored within the DMA. So each of these topics, there was a number of questions within that went into more detail, but it's worth noting here, you could probably see just from the colours and the way we've laid it out that there are common themes across the country. And there's not that much variation really in terms of when you average out the LMSs, you can see that on the whole, people have similar strengths and weaknesses at a high level. So that gives us something to start with in terms of trying to understand what the hot topics are that people want us to look into. And then this second map is when we break it down, we were trying to find out, are there areas of good practice in the country? Are there regions that are struggling? And the answer is not really. So you can see this variation of saying that there are good places in the north, there are perhaps places that are struggling in the south, but there's no north-south divide, there's no secret sauce really about how you crack digital maturity. It's a wider, more complicated story than that. So, Lancashire and South Cumbria LMS. So the overall score was 46, and the national average of the same measure was 51. So just ever so slightly below the average score. It's worth noting as well that 50 out of 100 on the scale was what we were aiming for really in our test, because we built those questions to say we want to make sure that we're covering all the foundations of digital technology, but we want to have a bit of growing room, a bit of aspirational space really, where we can repeat this again in the future and see how much we've improved. And so 46 is a good starting point. So when we break that down, all the diagrams I'm showing, by the way, are in the LMS report, so this detail is available for you guys to use. So here are the trusts that were within the LMS, the different system suppliers that they use, and then the overall score. So there is a little variation within your LMS between 40 and 58 there. I should say as well, this is a self-assessment, so these questions were completed by the clinicians themselves based on their local understanding. And so we're not trying to create a league table of all the trusts in England or anything like that. We just want to give you guys the resources that you need to start understanding your strengths and weaknesses as an LMS. So this is your LMS, the 14 sections in a table, and the red line there is the national average. So you can see there's some areas where you're above the national average, and then there's a section where you're below, and then other areas where you're bang on the national average. So the story behind this graph, to me, is all about what we call readiness, capability, and infrastructure. So these first 4 sections on there are all about how you get yourself set up to adopt new technology. Do you have the processes, the people, the understanding and the connections and resources in place so that you can adopt new technology when it comes? The middle section is all about how well you're currently using that technology, and then infrastructure is the thing that supports it. So to me, the question here is that you're ramping up to adopt new technology. You just have to identify what it is that's blocking you from being able to turn that readiness into actual capabilities. And it's worth noting then that if you're below the national average, as in these middle areas here, there's somebody out there who's already cracked those problems that you can speak to. We just have to find who those people are and how they solve that problem, and get you guys talking to each other to help overcome those things. And that's a really strong message from this work. We're trying to encourage collaboration, not just within the LMS, but across the country. So the raw data is available within your LMS report. So it's a resource for you guys to use. So if you're not happy with the charts and diagrams that we've used, there's that resource and information in there for you to use to actually do your own analysis and dig a little deeper into the questions. So that diagram that I just showed was the average for the LMS, but each of the providers is broken down as well. And so what I wanted to highlight with this diagram was saying, here are 2 hospitals within your LMS. I think we've got Morecambe Bay and East Lancashire Hospital. But what we're trying to point to here is the fact that one area where one of your providers is perhaps not doing so well, the other provider is doing quite highly in that area. And so there's that opportunity to speak, to get the providers talking to each other to understand how is it that you've been able to excel in that area and what can you learn from each other in terms of the specific points that are laid out in this report. So the other one there is standards, and it's the exact opposite. So there's learning points for both sides of the table. So I'm just going to dip into a couple of sections specifically of the report, and just to highlight what kind of detail lies beneath them. So decision support was one of the 14 topics that we explored. And you see here, this is an area where perhaps you're lower than the national average. So we can see that, yes, so the scores there are perhaps below that 35, which is the national average. And like I said, this is a self-assessment, so it will be specific questions. And sometimes it's right that you've said no to those things. Other times, perhaps it's an area where you would focus to improve. So these are around things like digital alerts for clinical risk, clinical observation alerts, digital prompts, and using IT to help support a woman's discharge. And so these are areas where perhaps only 1 or 2 trusts at each of those points have said, yes, we do this thing very well or all the time. And the others will have said, no, it's something that perhaps we only do in certain circumstances or we don't have that capability. So another area, business and clinical intelligence. So here we're talking all about how you can use data to help you forecast your services. And here you're about average, 46 to 56. And it's worth saying here that these questions, some of them are quite aspirational, I think, in terms of saying that we put questions in that we knew only a few trusts had started adopting this new technology, or it's a very new idea for maternity services. So that's why perhaps the score was not as high in certain areas. And then strategic alignment as well. This is an area where you guys are well ahead of the curve. So there's questions about how well you link into other parts of your organisation and their digital strategy in terms of things like finance and resourcing and other topics. So that was just a quick overview of some of the key points that came out of the LMS report. It's something that needs digesting, I think, and feeding into local plans. I'll just cover now really quickly the national findings. So rather than focus on any statistics for this, what we tried to do was do a root cause of that same diagram that I showed earlier, where we asked the question, what is stopping people who have everything in place from actually adopting new technology? We did a bit of research, we did a bit of root cause analysis to try and find out what these common themes are. So I'll run through them now. There are 9 themes. However, they may not all be applicable to your maternity providers. There may just be points of interest. But interestingly, some of them have already been mentioned today, earlier on in the presentations. So the report itself contains the 14 sections with in-depth analysis and an explanation behind the resources and drivers behind why we asked the questions that we asked. And then we've got the emerging themes, and then we've got the additional resources. So today I'm just going to talk about the emerging themes. So the first one is all around digital leadership within maternity services. Now, this is an area that is a real mixed bag across the country. About 3/4 of maternity services have a dedicated digital leader, which is great, but it does beg the question about what the other 25% are doing. Who's in charge of their digital service if they don't have a dedicated person? And of those trusts that said, yes, we do have somebody in place, we found that it was quite common that they didn't feel like they had enough time or resources to actually execute that job effectively. So the question there is about what can we do to help support these digital leaders, and those services that don't have them in place should be thinking about nominating someone to be a digital leader, whether that's a digital midwife or somebody else. The next is around the Maternity Voices Partnership. So the questions we asked in the DMA explored how do you engage different groups when you're doing a digital change, and we found that a lot of the maternity units definitely engage the staff, very proactive in engaging the staff in designing and implementing new digital technology. But then when we asked you actually speak to the service users, that number dropped significantly. So we felt it was really important to reiterate that message of saying, you know, even if you're doing something that you feel is very digital and behind the scenes, it's always worth checking with whether that's actually meeting the requirements of the user, whether that be the woman or the clinicians themselves. And we did a bit of research ourselves as part of this work. We worked with the Maternity Voices Partnership, and we did a survey with them about how what the thinking is out there in the world in terms of maternity services, and do the women and their families still prioritise the same things that they prioritised in Better Births. So the findings of that report is in there as well. So each of these 9 themes has its own chapter in the national report. And mapping the maternity pathway. I think this was something that was mentioned earlier today as well. Digital touch points, I think, was the phrase used, yes. And so interestingly, even if a maternity service has a lot of their clinical pathways mapped out, perhaps they haven't done that extra level of work to find out where the technology is interfacing with that pathway, and where it actually is an enabler in helping things to go quicker, and perhaps where it's actually a bottleneck, and something could be done to actually improve that technology or that process. But until you've started mapping that out from end to end, perhaps you'll struggle to implement changes in certain patches. The next is around connectivity for community midwives. And this is something that we've touched on as well, with the idea that when within a hospital they might have all the shiny equipment and bells and whistles and Wi-Fi, but as soon as we talk about care into the community, those community midwives often then are back onto paper, or perhaps they're struggling with outdated technology, or have real issues around connectivity, where they perhaps have to go to the local McDonald's to connect to the Wi-Fi to download things. It shouldn't be like that, really. So we've just started to explore this problem, and here's a graph that demonstrates that. So the blue bar is the average of these questions when we asked about it within the hospital setting, and then the light blue bar is within the community. So you can see that there's this drop-off as soon as you ask the same question within community versus hospital setting. So in the report, we started to explore potential quick wins that could help solve these problems, but ultimately it is a larger issue. And what does a good maternity system supplier look like? So often when we talk about these technical issues and digital problems, often it stems to the fact that certain capabilities aren't available within the maternity system. So for example, we just talked about community midwives. If their system allowed them to work offline, that would often make their lives a lot easier, but often the maternity IT system they have doesn't have that capability, and we're asking the questions, why not? So we started to pull together a bit of a checklist that we hope can help people define their requirements and actually help to measure how good their maternity system is compared to others. And here's a really interesting graph. It shows, we asked the question, are you considering moving maternity supplier for your IT system within the next 18 months? And you can see here, a lot of people said yes. So those blue lines are the current lines for different system suppliers, and then the light blue is the potential reduction that they could have. So you can see more or less every maternity system is potentially going to lose customers, or at least those customers are thinking of moving, which tells us that there is that dissatisfaction out there. Otherwise, people would be staying where they are. The next is around data, and we asked questions, and it relates to the LMS chart that I showed you earlier. A lot of people perhaps are struggling to once they've captured their data, use it as a real asset for the service, helping it to forecast their services and understand how they could make better use of analysts and people within their hospital to help them plan and forecast and use data in a more joined up way across the LMS. Business case and business change. So we've talked a lot here about these issues, but when we asked why they haven't been solved already, people told us that it's because they can't often get the funding, they don't have the evidence or perhaps time to write business cases, or they find out about things too late, or even if they are able to obtain resources, often it's only a small part of the pie, and the end-to-end business change doesn't get really kind of managed and taken forward. So new laptops might be available, but then who's going to embed them? Is there the IT support? Do we have that change and training for people? So we've explored that topic in here, and we've tried to sort of signpost to resources, and we're hoping that the evidence provided in these LMS reports and the national report will be useful for helping people to write better business cases, because the evidence is right there at their fingertips. At that time. Something we talked about before, social media. This section here is all about myth busting and quick wins. So we did some research, we asked people what they think the common problems are. We did some sessions with people around potential blockers, and then we took that away and we actually analysed the information, and we found that often a lot of these things are perhaps misconceptions based especially around things like IG, so information governance. There's a lot of kind of questions out there. Some people will be doing something, let's say texting their women or emailing women or using different tools to interact with women, such as social media, and other hospitals and maternity providers will be saying, no, we don't do that because it's not in line with our policies. And so we're hoping that this section will resurface those questions and say, look again, because there are people, we've showcased some really good examples of people who've done some really innovative things that other providers perhaps crossed off because they thought it was outside of what their remit in a way. So we just put this topic forward to help people reevaluate their assumptions on certain things. And the final topic is around our digital future. And it's here that we've captured a lot of the better birth requirements and ongoing bits of work that we're taking forward to NHS Digital, which I'll cover on the next slide in terms of pieces of work. And we just wanted to ensure that anything that's going on locally that we're encouraging people to do, that they just check in with the work that we're doing to see how it fits with the more national things that are coming out. So Charles mentioned earlier around interoperable records, that's one of our projects. And so if you're doing anything around electronic records, you might want to consider how you can join up with our work. And so these are the 4 projects that we're currently taking forwards. The first one I just mentioned is interoperable records. We're trying to get all the maternity system suppliers to talk to each other so that as a woman moves around the country, the records and information about her will flow, and that gives the clinicians better access to information, and it helps the woman to feel like she's not repeating herself as she moves between different care settings. The second one, another thing that Charles mentioned, and I heard other people talking about earlier as well, is the NHS.UK, or Choices as it used to be called. We're working very closely with them to feed in all the stuff that's going on across all the different maternity transformation programme pieces of work, and to keep checking that information and say, how can we get it so that it's going to be as usable as possible to local maternity services, but also ready for that transformation that we know is coming in. We've fed in, they're very aware of the fact that it is text heavy because that's what women are telling them, and so they know that, and they're working on how they can make it as usable as possible, and as give it as much kind of like profile as well through our work. So we want to make sure that if there are people with local websites, that they are able to signpost to the best information that's on NHS Choices. The next around digital maturity, which I've just sort of briefed you about in terms of the project. But going forward, we've created this rich asset of information that we've got now. We've given you guys access to our findings, but we're going to keep working now to see what we can do to support people to drive up digital maturity, and that'll be our next piece of work. And we're also doing a bit around digital care records for women, or sort of otherwise known PHRs. So can women access their information electronically, their records, and are they able to interact with that information? And so we're working to pilot that in certain places. So finally, next steps, and just sort of, that's not just for us nationally, but potentially useful resources for you guys too. So our networks, so this was one of the early pictures of that group I showed you earlier now that's about 200 people. It started off as about 20 people when we first ran it over a year ago, and we've just expanded from there. So we've got these resources. We've got a digital leaders group for the LMSs, where all 44 of the LMSs are represented there. And we've just launched a collaboration platform to get people talking to each other. So it's a kind of electronic group where people can log on and share resources, information, ideas, connect with each other. And we've also got an expert reference group for midwives, who we find a really valuable resource for running our work past them, but also that network of digital leaders is really helpful for them to exchange ideas too. So I just talked about our collaboration tool. We're also looking at a way of showing the data differently. So something that's a little bit more interactive. When we showed the LMS reports to people early on, they told us that's great. It's good that we're getting information as an LMS. But at the same time, our provider would like to be able to compare ourselves to a similar sized provider next door or on the other side of the country, because that's often how their sort of touchstone for how they measure themselves as a maternity service. And so we're trying to find a way of best opening up that information so that people can do their own comparisons. Showcasing the good and the great. The reports contain lots of examples of different maternity services. As I mentioned earlier, we've tried to say if somebody's already solved a problem or they've created an online service or they've told us about a piece of software they've had, we've tried to showcase them as much as possible so that the readers of the report can get directly in touch with those people or investigate what they did specifically rather than us just alluding to things that are going on. So we really want to kind of show what those good things are and wrap them up in a way that people can perhaps copy and paste the work in rather than having to reproduce things. And that could save a lot of time and effort across the country. So just to close my presentation before I sort of go out for questions and discussion, the reports are available. So the LMS reports and the national report have been emailed out to all 135 maternity providers and all 44 of those digital leaders. And we're hoping to make them more available going forwards. So the national report we're hoping to get up in a public space where anyone can access, possibly on the NHS England website. We're just working through the process for that now. But that will be a really useful resource, we hope, for people. So I'd really recommend that you read it if you get the chance. And then 4 things that you could do once you've got access to that information. One is hopefully you can revisit your local plans, looking at those suggestions that we've come up with in terms of 9 themes to explore. But also you could take the LMS data straight from the reports and use that to bolster your plans. Build up your LMS plans. I know that people have talked there about how do we create a joined up service for the LMS. Well, hopefully this digital report will help people to actually be able to do that, help facilitate that. Engage in regional sessions. So next year we're hoping to run some sessions where we get different LMSs together to start sharing best practice so that we're building a wider network. And then 4th, keep feeding your requirements into us. So we're listening. We're either talking through LMS leaders or contacting us directly. We're trying to capture those requirements so we understand what's a priority for you guys so that we can make that a priority for us too. But we just need to keep that communication channel open. And so that was it for me.
I'm not going to be difficult, but can I suggest that given the time that we're on, Ben is going to be around most of the day. He'll be around for you to catch him at lunchtime, and also if you've got lots of think digital things you want to talk about, to maybe join the workshop this afternoon, which is linked to digital, rather than take questions on this subject now, and then we can move on to our next speaker if that's all right.
Yeah, it's fine by me.
Is that okay? Thank you very much.
Brilliant, thank you.